Have you ever asked yourself, what is a community health worker? Better yet, who is a community health worker? The truth is, you've likely heard of community health workers, or CHWs for short. Maybe you even know the American Public Health Association definition, or APHA for short. The APHA defines CHWs as frontline public health workers who are trusted members of their communities and have an unusually close understanding of the communities that they serve, which is correct. But it also doesn't quite cover the wide type of work that we as CHWs do in communities every day. From the moment we step outside, we're working to make our communities better. In St. Louis, we define CHWs as trusted and reflective system intermediaries who work across sectors to build self-sufficiency within a client, patient, or neighbor. This is typically accomplished through activities like advocacy, outreach, and addressing social needs. But it can also be a lot more. So, who are CHWs exactly? What does our work really look like in community? Let's talk to some of the CHWs right here in St. Louis to find out.
To me, community health work at its core is about having the ability to be able to walk in the shoes of the individuals you serve. What do I mean by that? See, community health workers don't just build resources in order for people to have access. See, we build resources because we recognize the burden that comes along with the lack of that access. So we desire to build and cultivate relationships that can make that access easier. Community health work is about knowing the struggle of others and providing a safety net in the midst of that struggle.
While working in various settings, CHWs go beyond the traditional healthcare roles.
As a CHW, I work in reentry, so I help those who are coming out of jail or prison to remove any barriers for successful reintegration back into our community. I also help my clients to see their full potential and see the strengths that they have already inside of them.
Focusing on cultural traditions, beliefs, and needs within the Spanish community is essential in building a relationship. As a community health worker, I'm constantly building this relationship with the people that I serve. That is also founded in trust, compassion, understanding, and empathy. I provide services in their main language. That helps to break down the language barrier and improve the access to the services that can help them to make their living condition so much better.
Doing this kind of work means building relationships with people and meeting them where they are with what they need. The effects of the CHW work is far-reaching. Even other organizations are feeling the impact of CHW work in communities.
The CHWs in Missouri embody compassion, resilience, and a deep commitment to serving their communities with integrity and empathy. Their culturally sensitive approach helps bridge the gap between healthcare providers and the people they serve, ensuring that everyone has access to quality healthcare and essential resources.
I understand that systems have failed people for a long time because they weren't created for us or by us or with our best interest. And so there is a way with which people and systems have to come together. And out of all the things in my career that I have tried my best to lead or to support, the workforce and the leadership and the movement of community health workers and the coalition itself is really about the restoration of humanity and trust again from people who reflect the pain and the joy of those who need support and love the most.
This work is transformational, so it's not always easy, but it's rewarding. To us, it's not just a job, it's a movement. It's community leadership from within that's community-driven for community living. To learn more about the CHW movement, visit stlchwcoalition.org. in partnership with the St. Louis Integrated Health Network, found at stlouisihn.org.